Back to the channel. Today we're going to be reviewing my personal home kit, what I carry as a firefighter paramedic for the home. So the bag I use is a regular sports bag I turn into a medic kit. First off, I got trauma stuff there and the rest in the big compartment. I got a roll of tape secured here. As I open it, first thing I'm going to find is a set of gloves. These are heavy duty. Then I have two tourniquets. This one is a cheap knockoff of Amazon. It's just as a backup in case this one fails. This one is the Rhino rescue one. So I personally tested it and it works. So I wouldn't recommend it to anyone in the combat field, but I think if you have other options for securing a wound, you can use rhino rescue tourniquets. Then I got two 6-inch Israeli dressings. One is from Rhino Rescue, and the other one is from Persis Medical. So that's the real ones of Israel. So there you go. Then I've got another pressure pad with some foam. That's something we use in France, and it's pretty useful. It's a third dressing. Then, in case these don't work or you're in an injectional site, I have hemostatic gauze that works as well. It's not mandatory, but it helps. And I just have it in the home kit. Then I have a mylar blanket in case something happens in the garden or anyways. You gotta take care of the heat of your patients, so hypothermia prevention. Then I got two 5x9 pads for moderate to severe bleedings. I have a set of trauma shears that fell to the bottom of the bag, but I should be able to use it anyways, so I can just dig through it and find it out. Then I got a second set of gloves, still wrapped up, and finally a light, because not everything happens during the day. So that's what I got in this pouch. I'll set it properly after. So there you go. Then, as for the big compartment, I built specialty kits. So the red one is for wounds. Yeah, red means blood. You get wounds. Then the green ones is for burns. The yellow one is for ortho emergencies, so broken bones basically. And the blue one is diagnostics. And all my airway equipment is gonna be on the sides of it. So, and this is IV. So, as we go, you get your boo-boo kit, basically. Roll of tape, betadine. In case anyone's allergic to betadine, I got a second disinfectant here. A dose of normal saline for irrigation. Roll of duct tape, you never know. To improvise chest seals, basically. Then I got rolled gauze to do wound packing in case the hemostatic agent fails, or to wrap basic wounds. I got a whole lot of gauze. Each of these packets contain 5 gauze pads, so there I got 25 gauze pads. Then I got a bit heavier duty dressings. So these are the same thing. This is a 5x9. This is a 4x4 with the same texture as a 5x9. So there you go for these. And finally, I just got a few plasters at the bottom of the bag. The second compartment is a specialty kit. Don't pay attention. That was for combat medic purposes. So there you got small burn gel, hydrogel, and there you got a huge one. So that's an 8x8 dressing. So 20 centimeters by 20 centimeters for huge burns. Obviously, it's just for pain relief. Then we're gonna drive him to the hospital. A set of normal saline to irrigate the wound, the burn, in case you get any foreign objects. 2 sterile fields to wrap the wound in, and a huge ABD pad in case you need it. And then I got chocolate bars for in case of diabetic emergencies. If I have a diabetic person coming to my home, I better have it than not to have it. Then the yellow one is gonna be ortho-related injuries. I got 2 triangular dressings. All guys call these cravats. Super useful. I got 2 instant cold packs, a big roll of Coban to wrap someone's ankle, for example, and lastly a bomb of cold. There you go for orthopedics emergencies. Then we got diagnostics. So I try to stay basic, as I'm not in the ambulance. I'm not gonna do hemoglobin measures, stuff like that. I just got a cheap stethoscope, blood pressure cuff, adult size. It fits everyone. You just have to adapt the readings. Then I got a pulse ox with the batteries. Bag for emesis, so puke basically. Then I got stuff. I got additional batteries for everything, a digital thermometer, and a pupil light. The only thing I don't have in here is my glucometer, which is actually in my car kit. When I have lots of people at home or known diabetic, I just switch its place because they're pretty expensive. There you go for the diagnostics. Now as for the last pouch, it's intravenous supplies and the cases in which I'm gonna start an IV, or basically rehydration or volemic shock, in which we're gonna try and administer fluids. So in this pouch I got everything I need to start an IV. So I got gauze pads, a tegaderm, tubing set, a disinfectant, normal sealing in case I need a second flush, a tourniquet, so that's a venous tourniquet. I got a few catheters, so these are 18 gauges, so you can see 18 and 20. Then I just got a needle, I just got a syringe with a few needles just in case, a sharps shuttle, roll of tape, a saline flush, and a 500 bag of normal sealing, ceramic wrapper. And that's it for the pouches. Then at the bottom of the bag I got everything airways related. So the first thing every paramedic and EMT should carry is a back valve mask. So this one still in the wrapper, adult sized. Then I got Magill forceps. These are an ALS skill, so advanced life support, and I'm going to be using them to go and look for foreign bodies in someone's airway that could be obstructing it. I use it with a laryngoscope, but for now the laryngoscope is in the car kit. Then I got an improvised airway device, suction device. So the way I'm going to use it is that I'm going to take the 15 milliliter syringe and I'm going to connect it to this nasopharyngeal airway. I've tested it in the field. It does work, so that's just the way I'm improvising things, because mobile airway devices are super expensive. Then I got a whole lot of gloves, roll of tape, and tissues, because everybody's asking for tissues. So there you go, guys. That was my home first aid kit. Write in the comments if you have any questions about it, and see you next time. Have a nice day.